When I was in residency, I knew that I wanted to do hand surgery, and I knew I was going to want to do a hand fellowship, so additional training just in hand and microvascular surgery. I initiated some relationships with the hand surgeons in the region, had them come and talk, so I got to know them fairly well, and then went and trained with one of them at the University of Toronto. And then I went to Tampa, and when I was getting towards the end of my fellowship in Tampa, one of my mentors called me up and asked me if I wanted a job back at the university, at that time University of Western Ontario, as a hand surgeon. So I was asked to come back and join this fledgling group, which at that time it was two guys, one plastic surgery, the other one orthopedic surgery, both internationally recognized individuals. And so it was a wonderful opportunity to work with these guys. So I was the third one, and then recruited one of the fellows I worked with in Toronto, another plastic surgeon, and then another orthopedic upper extremity surgeon who I knew from the University of Toronto. He was a resident during my time. So suddenly there were 5 of us, and this allowed us to create a teaching unit, which allowed us to do a lot of research, establish a biomechanical laboratory with a biomechanical engineer running it, which we funded through research we did on developing implants for the elbow, amongst other things, shoulder, wrist, which we had patents on. So the royalties we got from that we used to fund our lab, which then brought us graduate students in, which became a generator for additional biomechanical orthopedic research. So that allowed us to publish a lot of papers on the work we did in the lab, but also because of the quality of the guys who were working in our unit, to get large clinical studies going and generate a lot of research papers in peer-reviewed journals, put us on the teaching circuit and speaking internationally. So it was a great professional experience because we were dealing with complex upper extremity problems. We were teaching medical students, we were teaching residents. We had fellows internationally coming to work with us, whether it be from Australia, from the Middle East, from the United States, Canada. So it was a very fulfilling job in many respects.